Yeah, hello. Good evening, viewers. Welcome to KDL TV Live tonight. We are privileged today to move on to another discussion. Today, we're going to focus on what's happening around the country and around the world. Obviously, we're talking about COVID-19, which has affected not just us individually, but it has affected communities here in the state of Minnesota and across the world. But today, we want to focus a discussion about what's really happening within the immigrant community, particularly the Africans within the state of Minnesota and beyond. And we're honored today to have some very resourceful members of our community who are going to help us share their thoughts on what's going on and what's happening within the state. So on set today, we have Mr. Bill Akuma, who is founder and president and chair board of trustees of the African Healthcare Workers Solidarity. By the way, they had a very, very successful rally yesterday in St. Paul. We're also honored today to have on show with Dr. Faria Farah, a good friend of the show. It's coming up for the second time. Dr. Faria is an academic, my colleague at St. Mary's University, and a dear friend. She's a community organizer, a public health worker, was a long experience in community organization and government sectors for over 20 years. She's also the vice chair of the board of trustees for this organization. We're also honored to have today Exilda Siame, who is the event organizer from yesterday's wonderful organizer. I think I would encourage that we focus on her, and she's also the communication director for this organization. So to start off, we want to welcome the president and founder of this organization, Bill Akuma, to share a few thoughts of what is this organization about and what are the aims. Bill.
Thank you very kindly, Dr. Jeremy, for giving me this opportunity to bring a light on the African Healthcare Providers Association. The aim of this organization is really to support the agencies that keep people in their homes, meaning it is there to provide the leadership to develop and provide strategic policies, support, lead and respond to any reform agenda, and also advocate for the minority organized businesses within Minnesota and beyond. So the need for this organization came about because we really were looking at a way of supporting the businesses that are minority owned, especially from African descent, so that they can start doing, so that they can be supported. So because as we know, lately, the healthcare industry used to be number two as far as being regulated. It used to, number one was nuclear power. But actually, after COVID-19 started, healthcare is number one. It's one of the most regulated industry after, and then nuclear power is number two at this point. So we decided to come up with this idea so that we can support organizations that are really helping these clients in their homes. And it's not only people that are in healthcare. The organization encompasses everybody and anybody that comes from the African continent and beyond. And they can be people who are not in healthcare as well. For example, in our organization members that we have people in IT, and the people will ask, why IT? All the equipments and softwares and all that we use in these organizations are supported by IT people. And we also have people from different sectors of industries like real estate. The houses and the homes that we house the client in, we buy through them. And also we have people from like towing companies, like Olympic. Towing company is they tow cars, but why should they be part of this? Because everybody that comes to this organization, even myself, we have cars. So we have vehicles that needs to be towed. So that is why like people ask, what is in this for me? I don't own a home care. And we also have educators. Why? Because most of the things that we do as it relates to policies and training has to be done by somebody who has an education background. So we came together as a team so that we can put everybody together as we move forward, because we do understand that we have to do organization. And we also do advocacy. What does that mean? It means that we're here to advocate for each other, no matter where we are. Also, when it comes to healthcare, we know that there is things like the state survey. We have the regulators coming to us. How can we do things right from the get-go? I'm not saying that we are not doing things right. What I'm saying here is, how can we really come up with the best practice so that as the state surveys walks in, if they know that you are a member of African Healthcare Providers Association, will do a good survey based on how your practices goes in that area. So that is that we came up with this organization.
Okay, that's a very good point. And by the way, I applaud all of you. Sorry, sorry. Did I lose you, Bill? Bill, it's you. Bill, can you hear me? Bill, can you hear me? It's you. Bill, can you hear me? Okay. Dr. Farah, can you hear me? We having sound issue here. Uh, Okay, we have technical problems there. Bill, can you hear me? Okay, they can't hear me. Dr. Faria, can you hear me? Okay. Ben, can you hear me?
I can
Ben,
hear you.
can you hear me?
Yeah, I can hear you.
Okay. Okay. So, Bill, can you hear me? Okay. Bill, let's move on to Dr. Faria. Dr. Faria, do you have anything to add on that?
Can Exilda hear us? Exilda, you can hear us?
The screen is full. I can. Oh, there comes Dr. Faria.
Okay, Dr. Faria, were you adding on something under that?
Dr. Faria we lost her. Okay, can you go to Exilda? Oh, Dr. Faria is back.
Okay, Dr. Faria, do you want to jump into that as well? Okay, I think Bill is also frozen.
Yeah, try Exilda.
Hey, Zilda, can you hear us?
I can hear you. Yes.
Oh, sure. Well, we can go on. Just add on to that as we work on the technical part.
Yes, I think Bill is right on. You know, I like that the association is not just really centrally focused on healthcare only, it goes from healthcare and associated services that are entwined with healthcare. So, for example, the example that he gave about transportation, it takes a car. I mean, a car is a luxury. It's a necessity. And all healthcare workers, whether they use busing, whether they use public transportation or they use private transportation, just a means to get to work is a necessity. And that is what contributes to making the whole entire healthcare sector more. But aside from that, those are the things that, for me, as a direct provider, those are things that, in conversations with employers, things that they need to look at when they're their employees and making sure that they're able to be ready and efficient healthcare workers, looking at the services that they need to bring them to work so they can provide the services that they need. Those are some of the things that I don't think that sometimes they are comprehensively looked at to the outcomes of healthcare workers would like to engage their employers into, and make sure that they work together as a team to find ways to make sure that the services that are required, especially in a time like this, is brought forth.
Get back to Bill for a moment here. I think, Bill, we lost you. Sorry for that technical hiccup there. Bill, can you hear me now? Oh, Bill is frozen, and I think Dr. Faria is as well frozen. So while the technical team worked on getting them live again, Exilda, I want to get back to you. This is an issue that is affecting all of us, regardless of our nationality, whatever background. Why did you think of the African immigrants specifically? No, I think we have Bill back. Maybe we can bring in. I'll get to you. Bill, are you there now?
Hello? Yes.
Okay, Bill. Okay, sorry. Apologies for the technical hiccup there. I was asking, great work you guys are doing, and I was mentioning that this is an issue that is affecting pretty much everybody, whether it's Americans, and Asians, Indians, whatever you have. Why did you choose to focus on Africans specifically?
Yeah, the reason why we choose to, you have to start home. Charity starts from home. And African are very many here, and when you look at who is actually at the front line, it is more of us than, because I've worked in healthcare for a while. Exilda can attest to this. The percentage of people that works there was, it was because of that percentage. It wasn't like we were trying to be biased on anything. It's just that that's where we started from. Charity starts from home. So, but even if it says African Healthcare Providers Association, it's another question somebody's going to ask about other titles of any organization. But the focus really is not only Africa, because really the clients and the people we take care of are not Africans. They are people probably who were born in this country. So we chose that so that we can bring the point home.
I want to bring in Dr. Faria. Faria, obviously, you've been on the show. You're an expert in matters of public health. You've done this for decades and decades. Why do you think this is very important from your perspective?
Well, if you think about what's going on about COVID, when you look at preliminary data the last 6 months, and you look at the 2 million have been infected with COVID, and if you look at the folks who have been hospitalized or the case fatality data, and a lot of new publications are coming up that really describes some of the inequities that is being observed. if you look at the data, COVID-19 risk factors, infection, hospitalization, death, there's a disproportionate number of immigrants, minority and low-wage workers that are in that data. When we say disproportionate number, it means higher than the expected number. And the expected number is typically your population size in the community. So needless to say, African Americans are dying at a higher rate, for instance, when compared to white population of similar population sizes. So this really speaks to existing health inequities that has existed prior to COVID. And the reason why we're seeing this troubling patterns is because of the social structures of inequalities that has existed and has been around for a while. Why are we seeing higher incidences of COVID cases and fatality and hospitalization in minority community? It's mostly, it's mostly related to poverty. For instance, they're more likely to live in crowded condition. They're more likely to work in service jobs that demands close proximity, for instance. As my colleague said, more likely to take public transportation, lack access to healthcare facility. And if we talk about African immigrants, for instance, there's something called public charge. Public charge is a policy that has come through Trump administration. What it's saying is, if you utilize public health systems, it disqualifies you from getting green card. So imagine the challenges that lays. Although COVID infection, COVID treatment or seeking COVID treatment or testing exemption from the public charge, meaning if you're infected with COVID, you're going to get treatment or being hospitalized does not disqualify you from your citizenship pathway. Nevertheless, it has a lot of immigrants, as you can imagine, who are wanting to live American dream. There's that as it spreads the virus. There's challenges of getting protective gear. Communities are more likely to have pre-existing conditions, more likely to have a higher rates or more immunocompromised in comparison to people around. Now that COVID is building on existing problems, that is even tougher. So clearly, when you combine all this factor, we're seeing higher incidences. Of course, also you got to remember the essential workers. A healthcare worker is an essential worker. Many work in healthcare, in operation, frontline roles. As a result, they have disproportionately higher exposure and higher, reasons why we're seeing some of the troubling patterns that we're seeing. Also, as my colleagues indicated, a lot of our workers, they work for instance, in nursing and nurse aides and in hospital care. They're in the front line providing cares in the facilities. So it also brings an incredible amount of challenge to the families, to the left, and very courageous. The nurses and the healthcare providers have really shown a will of steel during this pandemic. Not in America, throughout the world, and the rally was really to salute and give our accolades and tell them we love you, we know what you're doing, and thank you for lifting us up, and also risking it doing it. Not necessarily to African immigrant healthcare workers, but to all healthcare workers really that have been around, that are around.
But I'm going to get to Exilda in a moment as we work on the technical part to have her back on. I'm going to stick with Bill for a moment and Maria. I think the evidence is showing that this problem really is affecting majorly the minorities and the African Americans and African immigrants hit so hard. And so when I see you guys at the forefront of putting our people in this way, really there's every reason to appreciate you. So, but as best as you know to this moment, what is the state doing to make sure that our population is well protected?
As things go here, as Dr. Faria said, we are meant to work at not meant to work at the front line. We are nursing assistants, we are nurses, we are even nurse practitioners. We still have to work at the front line. And because of that, we don't have a choice. We will have to use whatever we have there, so we can really help support the people that are being affected by COVID-19. So your question is apparent right now, because even though we see a lot of problems in home care, for the longest time, home care has not been talked about. They were talking about people in, they were talking about people who are in hospitals, but home care was left out. And I probably think that is by design, because they think that they are home, so we don't need to really tell them. Even when you see the governor talking about PPAs, yes, he is saying that we have enough, but enough in hospitals and not in home cares. Because when we order the PPEs for the home care, it's very difficult to really get the number that we need, because the hospitals and nursing homes were taking the because of the acuity level that's existing in those areas. And as far as getting all that we need, PPs and all that, I know people that work in nursing homes. At some point, we didn't have any, and I have colleagues that work there. I have a staff that works there that have met out there. They say that they have to repeat some of these PPEs, and that's why you see African masks like the one we provided yesterday, made from African fabric, which you can reuse. You can wash it and reuse it. So that's how we became with that ingenious way of trying to make our own, because at the end of the day, it is me who is working who is going to be affected. Just imagine, because as Africans, you will find that the husband is a nurse, the wife is a nurse, the people that lives in your house are nursing assistant or PCAs. They all go to work every day. They come home. It is very hard to trace where, and I know of so many people that have been affected with this COVID. But thank goodness they stay home, they quarantine themselves. So as far as this goes, we don't have a choice. We found ourselves at the front line. If you are a nurse, you cannot work from home. If you are a nursing assistant, you are required to go to work. If you are a PCA, and all of them, Exilda works in healthcare as well. She's been working all around since March, since the month of, because she is frontline. Even if she is in management position, she has to go in. She cannot stay in a home and work there. That is the problem that we are seeing, and I might think that the worst is yet not behind us. So we have to protect ourselves as we move on. And I'm telling you, our people out there that are working in the healthcare, just to follow the guidelines. Wash your hands. And one thing that has really affected us is the social distance from the African culture. Very well. Sometimes you catch yourself trying to shake somebody's hand, and then you go with the elbow. It's not really easy for us, but we are running with it.
Okay, very good. So, Dr. Faria, quickly before I get to Exilda to talk about the event, what the thinking behind it and way forward, do you know what is the state doing really to address the problems affecting us? Really, any evidence?
Well, the state is deeply involved. The local government, public health departments are involved. City health departments are involved, and just to demonstrate the prevalence of COVID in our communities, we have the case contact investigation. And case contact is everybody that that is assumed to have contacted or has been exposed to the virus. 50% of case contact investigation in the city of Minneapolis require an interpreter. 22% of case contact investigation in the state of Minnesota requires an interpreter. This just tells you, in comparison to its very small population, it's almost 4 or 5 times higher need to have, and mind you, when you say interpreting, it's not just Africans, it's many, many languages, including Latino, which we have large populations of. So clearly that is a proxy. It has, there's 2 avenues for fighting COVID, and fortunately we lost the very first in containing the virus and making sure that anybody who has the virus is completely isolated to make sure that there is no, there's no spread of it. We have lost that battle. Now it's about the mitigation. The stay-home order from the state for quite some time, and that dramatically reduced infection rates. There is the state has given a lot of. They had about $50 million to the state to give local organizations. The Africans, they were given the cultural media were challenged to create messaging for the respective communities in their own languages. Education that was happening. All this, there was a lot of response on the ground. There's a lot of food that was issued, and then there's you. This was help a lot of the businesses, a standstill. There's a lot of grants that were given at different levels. The county was giving grants. The federal government was giving grants. There's problems with a lot of immigrant communities overcrowding and congregating on one each, in so meaning is a small space, and you have more than one person. If one person has COVID, opportunities to self-isolate. The United States has come up with creative strategies. They've created positions, isolation coordinators that will work with the various communities. The public housing unit that has a lot of African immigrants also have their own testing sites. They have their own termination program that is going on. They have mobilized community health workers and responders. So there's a lot of effort, language-specific efforts that have been put into place. But still, there was a delay in executing all this. As you all know, COVID has really hit us without proper preparation and adequate public health infrastructure as was expected. So I don't know if that answers your questions, Dr. Jeremy, but
it did. Thank you very kindly. So may I bring in Exilda here, if you don't mind? So Exilda, this is very good work that the state is doing, and obviously one of the major problems that we usually have is a lack of information. So do you mind talking about the event yesterday? What was the thinking behind it? How successful was it, and way forward?
Yes, thank you. So the event was very, very successful. We had a good turnout for a Sunday morning. People would like to sleep in on Sunday, especially with the faith gatherings. Still, some of them still back on hold. So you'd think that people would want to stay at home and sleep in, but thankfully, people saw the importance of doing. We had a pretty good turnout of people from different walks of life, largely Africans, who felt the need to come out and support their fellow brethren who are in the healthcare industry. So the thinking behind this was, in the heat of the moment, we had a lot of goodwill. Employers stood out and thanked their employees. Families came out. Both the patients and the residents in different healthcare facilities came out to thank the healthcare workers. But what I realized was, families of the healthcare workers themselves were missing from that grouping. And so best but to bring people from within the African community of those frontline African workers who are largely the frontline workers in healthcare system in Minnesota, whether it's in acute care, whether it's in long-term care, whether it's in home care services, like Bill said. I think Africans make up a huge proportion of providers. And I thought it would bring so much meaning to bring out the families, the heroes behind the heroes, to come out publicly and say thank you. And that was what yesterday was all about. And I think we did achieve that purpose.
So I'm going to stick with you again, Gilda. One of the problems we usually have, particularly when we're talking about the African immigrants, it becomes very difficult to define really who is an African immigrant, because we are divided into different nationalities. We are talking about Kenyans here, we're talking about Nigerians, we're talking about Ugandans, and all those countries that encompass the expansive African market. How successful were you in communicating the message to the communities, and going forward, how are you going to communicate so that at least everybody has some information about this?
So we had a small little group of cohort leaders from different African community we called on in that core team, that we shared the information, the plan and the vision, and we met through Zoom. And this group included community leaders from different African communities, and through them we sent this word out. We had flyers that we sent them back with to share on their own community-specific groupings that would go out. And then also we used social media as well to have people use Facebook to post the flyers, word of mouth. The organizations that we worked with posted those flyers on their boards, in their break rooms. So those were some of the to message that and to send the word out, because like you say, African immigrant groups are so many, and to reach each one of them individually would have been just totally difficult. But with bringing those leaders together, the presidents, the committee members of those groups, and asking them to collaborate and take that word out through the flyers, through social media, and also sharing that word out among African workers at different workplaces, were some of the avenues that we used.
So part of why we're doing this series of discussions is that we want here at KDL TV try to, as best as we can, bring together the African immigrants so that we're able to drive a positive diaspora agenda. I think that's key. We've had so many challenges within the community, but we recognize as human beings we're going to continue to have this problem, and particularly with the COVID-19, it's not ended. It's going on. So we expect this. So I want to get to you, Bill, as the president and founder of the organization. How do we move forward from here?
Very good. Thank you so much for again. I think from with forming some committees, and those committees will encompass clinical team, will encompass advocacy team, will also encompass consultation and training, and that with because of what's happening right now, you know, there is a problem of mental health, which is affecting a lot of us, because with all this anxiety, agitation, and all that has been going on, people have been quarantined without even wanting to be quarantined. So what's going to happen is the aftershock, after COVID-19 shock, which will have a lot of people having a lot of those things that I mentioned. That we are going to do is to introduce a mental health training, which is going to be an eight-hour training. If some of our members wants to be instructors, I'm a mental health instructor, mental health first aid USA instructor, and that is also Dr. Faria is that as well. We also to look at ACEs, the adverse childhood experiences. And how do those relate to what we are having right now? That is under training and also, as I said, advocacy. We want to advocate for our organizations that are members and even those who are not. We know there are people who want to also be in business, who wants to do the right thing. We also want to move forward. Always tell people the cake is so big. The only thing that is going to break out is the knife that cuts the cake. So how can we come together? And that's why we have that African proverb that says, if you want to go far, you have really to go together. If you want to go fast, just go by yourself then. And as Maya Angelou will always say, we have done things in the past that were, and it's not because we wanted to, it's because probably we had to, but it is about time to know that when you learn, you teach. When you get, give. So now for those ones of us that have really seen and tried to gain the experience, like Exilda, Dr. Faria, you, Jeremiah, and everybody else, we together really put our heads to is that theory of the six thinking hertz. I've never thought that anybody that is at the table really does not bring anything. Everybody has a stake, something to do when it comes to waiting at the table. And I will also echo Martin Luther King in 1968. He said that I've been to the top of the mountain. And really, yes, there's something that was happening in Memphis, as Dr. Martin Luther said. I wouldn't say Memphis because there is something really that happened in Minneapolis. Something happened in Minneapolis, and it is through that spirit of togetherness that we want to move forward and really come together and do what is right from the get-go. That is the focus, and we are going to, you and everybody else.
Okay, very good. Thank you, Mr. President. So, Dr. Varia, I know this is your area, public health. In as much as we are talking about this aspect, we're also talking about us taking care of ourselves. I think sorry, somebody's calling me. Somebody's calling to ask some questions for you, Dr. Faria. So, from a public health perspective, what do you say to our people? What should we do to continue protecting ourselves?
All right, very good. I'm glad you asked that question. Number one, when you have the infection, you are shedding millions and millions and millions of virus. The bigger you can do for yourself, your loved one, do for your community, for your, for your co-workers, is to stay home. Because look at the biology of COVID and the way it infects. You potentially within a week can infect more than 1,000 people. One person can potentially infect more than 1,000 people, and it's something that goes exponentially. It's not a linear infection. That's why it was able to spread across the world in such a short time because of the transmission rate. So that's the number one thing. Of course, I am assuming right now, people in Africa who are watching this, and every African immigrant who is watching this in the United States, recognizes that there is no substitute to hand washing. You have to wash your hands religiously. The viruses, whenever you touch your nose, you touch your mouth, and let's say you're infectious. And one of the most dangerous thing about this virus is you might be having it, you might be transmitting it, and you have no clue that you have the virus. You don't even have a clue. If you don't have a clue that you have the virus, imagine, how quickly and frequently you're exposing others. So the best thing to do is put your face mask on. It reduces, it protects you, people around you. Researchers indicated it's almost 50% or even more. There's this evolving research, so there's always new information coming out. Wash your hands, put your masks on, stay home when you're sick, and also there's a lot that shown quality increases the survival rate. So sick treatment as soon as possible. There's a lot of information in the social media, a lot of false information in the social medias and all that. Get information from trusted sources, but to take care of yourselves and your families. And you got to remember, 80% of people who get it are survivors. You get sick, flu for a couple, maybe a week or two, then get well. It's the 20% that are immunocompromised that are hospitalized, and then about 1.4% actually die of it. In America, we're seeing fatality rate of people as young as in their 40s, young, 19. It all depends on where in the spectrum of immunocompromised you fall under. So the thinking that it's all people who are dying is not true. It's not true at all. So we are also susceptible, and precautions there are pretty standard. Just to be, I know people are getting tired of cough, but be vigilant. But wash your hands all the time with soap for 20 seconds.
I can't agree more with you, Dr. Faria. And by the way you explain is so eloquent and to the message that. So as you prepare, as Bill and Dr. Faria prepare to make a closing statement, let me talk to Exilda. The key point here is to stay on message. You organized a very successful event yesterday. Thank you and congratulations. And the other thing is, people are assuming that we have resumed to the new normal. The people who are saying, "Oh, look, we better get back to work." But remember, from a political perspective, the argument is that is politics and economics. But at the same time, we have to maintain the healthcare message as possible as we can, particularly to our people. So, was the event yesterday the last one, or are we expecting more events in the days to come, Exilda?
And Dr. Faria mentioned trickling issues that from just going through this COVID-19 experiences. So we're going to take advantage of everything that we can get our hands on: mental health education, to ask the grants, advocating for the right PPEs in our workplaces. All of those issues are things that we need to be aware of and keep upfront and personal. But I just wanted to get back to Dr. Faria's message about what next? What do we do to prevent that COVID-19? And I wanted to speak from the inside out, from the healthcare workers' perspective within the four walls of their organizations. It's so important for healthcare workers to make sure that they utilize the PPE that's used to them properly. It's one thing wearing a mask and wearing a mask properly. We have to be aware of how COVID enters our bodies and making sure that we ask for the appropriate PPEs from our employers. We use them appropriately. In working on the inside, a lot of times I see people too familiar with each other, and sometimes they take off their masks, they take off their face shield. I know and I understand that it's very, very difficult to work with the PPE on, but this is our new normal, and we have to do everything that we to make sure that we protect ourselves and protect those around us. I'm hoping that somebody from the African community will be inventive enough that they'll come up with a mask, maybe that weather, maybe have a face shield that will be user friendly, because this is going to be our new normal. And we need to put on our thinking caps and start thinking of, if this is what we're going to work on to protect ourselves and protect other people around us, how can we do it differently without making this a convenient? So I'm hoping that this idea will come from Africa so we can be the trendsetters. But from the inside, on the job, health workers, we're not just about protecting ourselves in the community, but protecting ourselves on the job and making sure that you have the right PPE. You learn how to use your PPE properly, and then you keep yourselves, the patients, all the residents safe, so that when you go out in the community, you're safe for your families.
On that before Bill sums up. Dr. Faria is muted.
Hello, yes. Can you hear me now?
Yes.
Yes, okay. Just one more comment, and a little provocative, I guess, to especially my my countrymen, my African countrymen, people who are right now watching. We are eagerly anticipating COVID vaccine, and we are hoping COVID vaccine will come through as early as the beginning of 2021. Now, in my heart and in my head, I know the competence and the knowledge based to produce effective vaccination exists within my continent. And I eagerly wait and read and look at data, and maybe the viewers will direct me to some data that are also competing to produce COVID vaccination for the African people. You know, it will be disheartening, and let to this, maybe it's not true. It will be extremely disheartening if the reality is that African countries are not getting are not they're not competing, and right now doing creative research in producing COVID vaccination. You know, I think after 50 years, 60 years of independence, we should be there with South Korea and other countries that have received their independence about the same time. If not, this is a moment for the biotechnology industries in Africa to ask themselves, why are we behind? Are we waiting for other countries to produce? Because countries, when they produce, who are the first patients? Their own people. You know, if the United States produces vaccination, it's for the US population. If we have extra, we'll give it to you. So it's something that I like before we end this. It's something that requires maybe another show, Dr. Jerema. Where are we in the biotechnology in fighting this disease?
Thank you very much, Dr. Faria. And so, Mr. President, you want to make a closing statement, please? Bill, you want to make a closing statement? Is Bill there? Bill, please, it's your turn to make a closing statement.
Very good. Thank you. Thank you again, everyone, Dr. Jeremy and the organizer of this show. I will end with my friend and my mentor and the person that yes, can you hear me?
Yes.
Can you hear me?
Yes. Yes.
Okay. Yeah, so I'll close by echoing. You can hear me?
Yes. Yes.
Okay. Okay. So
Yes.
I will close by echoing Hela. And he said, be passionate. Everyone can rise above their circumstances and achieve success if they are dedicated and passionate about what they do. He also said, make a difference. What counts in life is not
Oh, is it? Looks like Bill is still frozen. Ben, is that correct?
Yes, Bill is frozen. Yep.
Okay. So I think, apologies. We need to get moving. Sorry for the technical problems there. We're going to finish up here. I want to thank the panelists for coming on. I want to thank, to begin with, Exilda Siame. Thank you very much for coming on. I think you did a fantastic job to trying to communicate the message to our audience. And I hope you promise to come back to the show so that we continue staying on message. And that's the only way we can continue driving this positive diaspora narrative. I want to also thank Dr. Faria. Dr. Faria, thank you very much for coming on the show again. And I think this is an area where you're an expert. Again, KDL TV welcomes you all the time so that we can also continue to stay on message. Of course, sorry for Bill for that technical problem, but thank you very much for putting the team together. And obviously, we're going to end on this to make sure that we're together. So I also want to thank the technical crew, Ben Kibato and family, for doing all the hard work from behind the scenes to make sure that we continue to drive this positive diaspora narrative. So again, I want to talk to our viewers and watching. I welcome you tomorrow. Sam, we want to welcome you to another, what will be very interesting show we have lined up. Because we're going to talk about education as well in the times of COVID-19. So we're having a number of very knowledgeable professors who are coming to give their insights and perspectives about what we need to do. So we're requesting that all students, African students, need to tune on. The parents, community leaders, please tune on. Let's hear what professors are going to say tomorrow at 7 Central Time. We're also welcoming you on Sunday at 11 a.m. Central Time. We'll have a panel of African students who are also going to share their experiences during this COVID-19. And then a week later, on 24th at 7 p.m., we're also going to welcome religious leaders who are going to come to the show to also give us their perspectives. But before I finish, I see the technical team has worked hard to bring Bill. I think it would be dishonorable to move on before I let him say the last word. Bill, last word?
Thank you very much, Dr. Jeremy and everyone. I really want to finish this show by echoing Nelson Mandela. He said that be passionate. Everyone can rise above their circumstances and achieve success if they are dedicated to and passionate about what they do. He also said, make a difference. What counts in life is not the mere fact that we have lived. It is what difference we have made to the lives of others that will determine the significance of the lives we lead. He finished by saying, be optimistic. I'm fundamentally optimistic. Part of being optimistic is keeping one's head pointed towards the sun, one's feet moving forward. There were many dark moments when my faith in humanity was sorely tested, but I will not and will not give myself up to despair. That way lay defeat and death. I thank you all and have a wonderful evening.
Desk, thank you so much for tuning on. We look forward to seeing you again tomorrow, 7 p.m. Central Time, when we have some of Africa's best and brightest professors coming to share their views, perspectives, and analysis about what COVID-19 means to students, families, and way forward. Thank you from us here again. Good night. Hey, Ben.
Yes, Dr. Ari, we are good.
Are we done?
Yes, we are done.
Hey, you better tell us we are done. We are sticking. I was waiting for the last commercial